Hi, everyone. Thanks for joining us again. I'm excited to talk about a topic that's incredibly important when it comes to managing diabetes. We're talking about preventing long-term complications. The idea of developing complications can feel overwhelming, but the good news is that small, consistent changes can have a big impact on your health to avoid these complications in the long run.
My name's Dale Stern. I'm a board-certified internal medicine doctor. I'm here with my partner, Jennifer Stern. She's a nutritionist and a personal trainer. And we want to talk about an important subject related to type 2 diabetes, and that being the long-term complications of the disease. And I want to emphasize finer points of these complications so that you have a better understanding kind of what you are potentially up against should there be issue with managing the disease in the interim years, which I find a lot of people have a problem with. They struggle with that. So I think when it comes to thinking about long-term complications of diabetes, a lot of people are not associating the condition with the multitude of conditions and diseases that ultimately take place in the long run. And it happens because it's so insidious, by which I mean you may not notice it in the first month or the first year or first few years of the disease, but diabetes uncontrolled long term causes a multitude of illnesses and diseases, ranging everything from stroke, which you'll experience in your brain, which can be devastating, to a diabetic foot ulcer. It's really head to tail.
And these are preventable.
These are totally preventable conditions. And really the unifying factor here is being able to take good control of the diabetes in and itself.
And this can be just small changes that you make every day.
That's it. I mean, the key is really staying on goal with making sure that that blood sugar, which really seems to be the major problem for diabetics, is under control more times than not throughout the week, throughout the month. And that comes down to being on track with
consistent
taking medications, if you're on medications prescribed by your physician, being set up with a good nutrition plan, having real strategy, understanding what type of foods are good, how to eat them in the right combination, proportion, preparation, and also making sure that there is some level of fitness that's incorporated within your week.
Yeah, in fact, even a 15-minute walk after meals, even specifically dinner, can improve your insulin sensitivity.
Absolutely. And I think that if you were to reverse engineer all this for somebody who wants to know, why is it that I'm on dialysis? Why did I have a heart attack? Why did I have to have my toe amputated? Really, it comes going back to dysregulation of blood sugar, which ultimately is a major contributing factor to the development of the type 2 diabetes. So being able to control that type 2 diabetes helps to avoid all this catastrophe in the long run. Really, the major issue starts with the blood vessels. A lot of people don't realize, almost as bad as smoking, worse than high blood pressure, diabetes contributes to vascular disease. And the way that it does this is it ends up causing thickening of blood vessels, hardening of blood vessels, atherosclerosis over time. And when you have poor blood flow, it's going to increase and contribute to high blood pressure, and this starts to create a spiraling effect. And when you have organs under high blood pressure with poor blood flow, they react unfavorably to this. You wind up seeing patients who are on dialysis as a result of diabetes, because the kidney is affected both directly by the high blood sugar itself, as well as the issues as far as blood flow and microvascular disease. Stroke, we see issues with vision and diabetic retinopathy. There's nerve damage because the high glucose levels directly damages the nerve itself. Why a lot of people complain about neuropathy, that they have poor sensation in their extremities. That leads to injury. And if you can't feel that you've maybe cut your skin open on your foot, that can lead to infection that can ultimately fester. And that can be very hard to control. Often at times I see a lot of people wind up having to have amputation because the infection has subsequently invaded the bones inside their limb. Those are just a few examples of the devastating effects of long-term uncontrolled type 2 diabetes.
So I think key thing to recognize is that these, like I said before, these are completely avoidable. How do we avoid them? Consistency with your nutrition, with your physical activity, with managing stress.
That's right.
with sleep hygiene. All of these factor into the bigger picture. And when you have a patient lying maybe 50 years old, you don't even have to be middle age at that point. You have patients who, what does dialysis mean for everybody? This is a major inconvenience to your life.
Absolutely.
You are at the hospital or at a clinic every day.
Yeah, well, it's 3 days a week.
3 days a week, sorry.
And 3 hours at a time. And that doesn't account for, transportation. So this becomes a huge part of your life. And that's why so many people are so disappointed in the long run. How could things have been maybe different? It's a very unfortunate situation.
So the power of consistency and accountability right here to help carry you through to make these lifestyle changes that I mentioned should not be minimized, because we know it is hard. And that's how people end up in those scenarios hospitalized, because it is hard to
Absolutely.
make changes.
And I say to people who have that opportunity, better to cry now than cry later.
Right?
Because in the long run, the costs and the stakes are much higher. But in the interim, while you know that this is something that is well within your grasp, something that you can take control of, better control of, if you really dig in and take the time, the benefits are exponential.
Yeah, and these small changes may not seem like much on their own, but they are significant. And when you do them consistently, you will see improvement. You'll see improvement of your disease. You'll see improvement of your longevity, meaning you will live longer with better quality of life, avoiding these complications. And that's why support for these lifestyle changes is so important, because they are really the crux of reversing disease and avoiding complications.
Let's put it this way. You can either decide early on whether you're going to take a proactive approach to one condition, or whether you are going to be bedridden in a hospital dealing with a multitude of conditions as a result of not early on taking that proactive step towards controlling your diabetes.
Yeah. Having a group setting that of people who are going through the same challenges and can walk you through what it's like and lift you up and support you and keep you motivated really can make all the difference, so that you stay motivated to make these changes, because it takes time. It takes 12 weeks, 3 months to make a sustainable, lasting behavioral change.
And really, that's what's going to take in order for you to see improvement to feel it physically, and also to see it on lab work as well.
Yeah. And that's why we created our community, because we know that this change can be hard for most people. They have not incorporated these lifestyle habits, and that's how they've ended up with this diagnosis, potentially as a contributing factor with genetics as well, and lack of activity in their lifestyle. But having an ongoing support group and level of accountability, you're more likely to stick with these changes that we have implemented, that we've created for our members. And having that support system cheer you on really is everything. So let me share a couple of success stories of people who've been in our community, and so you get an idea of what's possible with these small, consistent changes. I worked with Sarah, who started by adding a 10-minute walk after dinner. And the one small change, this one little thing, just shifted her mood and her energy within a matter of days to it was 10 days in. She was like, wow, I have so much more energy getting through the day. I'm not dragging myself to dinner time even. She was able to incorporate this activity, and she's just feeling so much more in control of her health. And I love that for her. That is just everything to us, to our community. And she gives full credit to that lifting her up, and she's motivated to keep going, which
it's
is critical.
Example of small steps lead to big gains, big leaps.
Yeah. And then there's Mike, who was really overwhelmed because he got this diagnosis, and the idea of changing his diet was just very daunting, as it is for most people. So we started just taking a small step. We replaced some of his snacks, which were more sugary kind of foods that he didn't even realize. And, after examining them, they were being processed and broken down into sugar. And so looking at maybe having some nuts and fruit, whole real foods with fiber and healthy fats. These are small changes that really help stabilize his blood sugar throughout the day. He is so much more confident, and now he's encouraged to make healthier choices during his meals, right? So one small step, and now we're just compounding those effects.
That's it.
And he's motivated to keep going.
Yeah, I think when people see some improvement, they want more.
So these are the kind of transformations that are possible with our community, and exactly what the Diabetes Solution membership is creating. This is what the Diabetes Solution community is all about. And we're here to help you make those small adjustments and stick with them and see results over time.
You also gain access to our Diabetes Solution course, which is totally comprehensive, self-paced, and it provides all the information that I would want to give to my patients if I had, the 80 minutes to sit down with them in clinic and tell them all the things that I really wanted them to know to make good, positive changes.
Yeah, and our monthly live calls where members of our community get to ask questions, and there's a whole Q&A happening, which is wonderful and engaging, and you don't really get that in a 5-10 minute doctor's visit. So, and you're connecting with other people in this community who are on the same journey, pre-diabetic or diabetic or family members. So everyone's really feeling that compassion and camaraderie, which is encouraging for the long run. And ongoing resources. So you have meal plans, you have exercise guides, learn how to go food shopping, you learn how to order at restaurants. Most importantly, you're a part of our supportive community that provides the accountability that you need to really succeed and take control and work towards reversal.
Absolutely. So thanks for being with us today, and I hope that this has given you some more clarity and understanding about how small changes can lead to really big impacts in your life as far as your health and wellness is concerned when it relates to your type 2 diabetes.
Yeah, staying consistent is where the real transformation begins.
Absolutely. And I think that this is such an important opportunity to make this time to invite you to our diabetes community and allow you to continue on this journey. And even though it is largely unique in your own life, there are other people out there who are experiencing the same thing. And it's great to have that sense of knowing that there are others out there like you who may be struggling, but who are really trying to get on the right path and want more of life, want better, and know that they can achieve it too.
So click on the link below to learn more, and we can start working together to build a healthier you. And I can't wait to welcome you into our community.